Dey. Indranil, are you ready?
Yes, hi, Oli. Thank you for this opportunity.
Okay, your time starts now, 10 minutes.
Sure. I'm going to start with this video first, and I hope all of you can see the screen, right?
Yes.
There's no audio to the video.
Hi. Sorry, 1 second. Yeah, hi. This is Indranil, founder of mySvasth. Can anybody hear? Because I believe I heard a comment.
Yes, we can hear you.
Okay, yeah, I'm founder of mySvasth, which is a elective surgery marketplace platform with two distinct capabilities, addressing an addressable market of 252 billion, focused in United States and India, two different countries with two different payer systems. And I'm seeking early stage investment of $5 million, where the proceeds will be used for operating expenses, such as hiring and marketing and sales, to establish proof of concept. Swasth's first capability is elective surgery marketplace, which is very similar to Trivago. It is geared towards B2C, that is consumers who are paying out of pocket, and so that they can come to the site, search, compare, and buy elective surgeries based on cost, quality, and facilities and amenities.
Can't see your slides, Indranil.
Sorry?
We can't see your slides.
Okay. No, I was basically trying to introduce myself before I get into the slides, if that's okay. But this is basically the two capabilities. So I was talking about the capability one, which is geared towards the B2C market, that is out-of-pocket paying patients, such as uninsured or the people with the high deductible plans. And this capability reduces the healthcare costs based on free market competition. Capability two is a request for quote platform, which is for B2B segment, such as self-funded employers or the coalition, where they can come to the platform and prepay bulk purchase of predictive elective surgeries so that their employees can use it in foreseeable future, right? This capability will be disrupting dental and vision insurance. So why did I created this platform? Prior to this launch, for last 9 years, I was in a healthcare business, which was private health advisory group, where I provided US care in emerging markets. And one of the issues which I saw was patient has trust deficit across healthcare providers. They simply do not have any mechanism or any tools where they can compare multiple hospitals based on treatment plan, cost, and quality metrics so that they can make informed decision. So that was one of the drivers why I launched this platform. The other was a little personal because a few years back, my wife, she was misdiagnosed with ovarian cancer because the markers were similar. So it actually turned out to be endometriosis. So she went for the surgery and she collapsed because the anesthesiologist put the tube deep inside her lung. And the reason I share this story, because in a patient's journey, there are various entry points for errors, right? It's just not limited by the surgeon. It's also the anesthesiologist, it's the nurse, it's the medication, and guess what? It's also up to the patient. So if I have a knee replacement and 4 weeks down the lane, I go for my biking, then good luck to me. So all this prompted me to create this platform, mySvasth, with 2 different capabilities, addressing 2 different markets, focused in United States and India for now. So this is, I basically introduced the most of it through without the slides, but this is the solution which I already spoke, the capabilities, and why the solution will work, because the future of transparency, the bundle payment, the timing is right, because what we saw that COVID accelerated consumer adoption for digital health, because we have seen with the virtual care how long it took for people to adopt. So from that point of view, the timing is right. And again, this is for the go-to-market strategy, the countries they would be looking to go. This is the addressable market.
You're trying to share slides, we can't see. You need to share your screen.
Okay, I'm sorry. So I thought I was sharing my screen. Yeah, can you see the screen now? Sorry about that.
Yes.
Yeah. So, I mean, this is SVasth, as I said. I mean, so this is the solution, as I indicated, about 2 different capability. One is very similar to Trivago. Sorry if I'm reiterating, because it seems that my screen wasn't shared. And you have the other feature, which is the request for quote, which is geared towards B2B segment. This is how the comparison looks, where a consumer can compare an elective surgery based on cost. What does it covers? It doesn't covers. That is the bundle pricing. Quality metrics. So if you're going for a bypass, the right questions to be asked is, how many bypass my surgeon has done or the hospital has done? What is the infection rate? What is the readmission rate? Because as of today, consumers are driven by referral, they're driven by Google 5-star ratings and top ranking. They believe the more expensive the healthcare system is, the better the outcome. But the reality is none of the three components, that is the referral, Google 5-star rating, or the top ranking, has any direct correlation to the outcome of a surgery. So they need to ask the right.
Your time is up, Indranil.
Okay.
Judges, do you have any questions?
Indranil, can you tell us a little bit about your team? I only see you.
So I have, I call them a SWAT team. I have a team in India because I'm launching it in India, and I have a team in the United States. And they all come with domain experience within the healthcare value chain. And I'm very proud about my team.
Hi, this is Shubhra here.
Hi, Shubhra.
One question is, in the US market, how are you positioning this for the US market?
Sure, that's a great question, and thank you for asking. So in US market, for the B2C, our customer segments are going to be not only going to be uninsured, but the people with a high deductible plan. And the reason is, what has happened in the last 10 years, employers have been passing the cost to employees in the form of high deductible plan. It has gone up to 174%. It has come to the point that today, a family of 4, the average high deductible is around $13,000, give or take. So what does that mean? That means if they have any kind of a low-hanging fruits surgery, such as cataract, gallbladder, circumcision, any of those surgeries, they are actually paying out of the pocket. Not to forget about screening and diagnostics, right? So coming back to your question, we are focused towards the B2C, that is people with a high deductible plan and uninsured. And B2B, we are reaching out to the coalitions, the self-funded coalitions, where we are proposing them to buy dental and vision, where we are more focused towards the dental and vision segment.
Understood. Thank you.
Any other questions from the judges?
Can you comment a little bit on your implementation on the US? How does it compare to your experience from Asia, and what are the obstacles and how are you overcoming them?
So I'm based out in US. So we just finished this platform a few months back. So it is still in a pre-launch phase. And the reason is because we are creating the inventory, right? Because if you go to an empty Amazon.com, you're not going to go back again, right? So right now we are creating the network of hospitals and creating the inventory. And that's exactly the same happening in India. Actually, it's much ahead. We have put some inventory over there, but we are going to make this platform live by the 4th quarter. The product is already built. It's technically live. It's just not, we have opened up for the consumers because we are building the inventory.
Okay, thank you very much.